Karibu sana, community members, our chair, representative of our PS, who is also my boss.
I hope it's still morning or it's afternoon. Yes, thank you so much. I'm privileged to be here, and today indeed marks a meaningful step in our journey as we launch the World AIDS Day Half Marathon, a powerful event aimed to raise awareness, unite us in solidarity, and assess the strides that we have made in the fight against HIV. And we really commend the great work that has been done globally, regionally, as well as within our country. The global objective, as we know, remains clear. We hope to end AIDS by 2030 and guarantee treatment for all people living with HIV, as well as preventing HIV new infections. The countdown is on, and we are committed to reaching this. So we have only 6 years left, but I believe that we can race against time and we can achieve this and end AIDS by 2030, as well as ensure that all our people living with HIV are on treatment, as well as preventing new infections. This marathon again is integral part of Kenya's national spirit, because it symbolizes our resilience and athletic prowess. But again, today's marathon goes beyond this. It's a call to action in a battle we cannot afford to lose. Over the past decade, as has been shared by Dr. Masha, we have achieved a lot. We've been able to reduce HIV in new infections by 83%, I believe. And the number of people living with HIV who are on antiretroviral therapy have doubled. So most people are actually on treatment. As well as AIDS-related deaths have gradually dropped by 65%, from more than 58,000 to more than 58,446 to 20,480 in 2023. And so we are seeing great, tremendous steps when it comes to management of HIV infection. Still, you know, each life lost it represents a family. So what can we do in order to achieve and ensure that no one is dying of AIDS-related illnesses, how we are addressing new infections, and ensuring that viral suppression continues within our country. And that is why we need to synergize our efforts. We need to come together and work together as the various communities in order to achieve 95 achievement, as has been talked about. Equally, we take note of the viral suppression that 97% of Kenyans who are people living with HIV have been reached, but we need to ensure all are actually on treatment. As has been shared, great challenges have been seen, and especially in children, adolescents, and young people. Adolescents, especially the young girls, we see that they face the triple threat: HIV infection, early pregnancies, and exposure to sexual and gender-based violence. And for us, in order to address these things, we need to come together and harness our collective power to address these triple threats. As you are well aware, His Excellency the President, Dr. William Samoei Ruto, has placed universal health coverage at the forefront of our agenda. And one of the priority is the fight for HIV/AIDS and ending AIDS in 2030. That has been incorporated within our strategy, and we look towards working together with the various teams and various communities to achieve this. So this year's World AIDS Day commemoration is a rallying call focused on one aim: ending AIDS and confronting its associated risks, that is new infections, unintended pregnancies, and gender-based violence. A mission we refer to as ending the triple threats. By participating in this event, you will play a critical role, and so we are inviting you to this because it will help us in public education, in raising awareness, as well as handle the stigma surrounding HIV. And so your involvement in spreading the message of hope, resilience, inspiring others to take action is indeed critical. As we commemorate the World AIDS Day 2024, we will also focus on promoting health and well-being of the men and boys. I like what our colleague talked about. The father, the male figure is actually the sole breadwinner, is the head of the house. And while looking for food for the house, they may forget themselves. And so how do we ensure that there's improved accessibility for the men and the boys in terms of care, HIV care and other treatments that they may require? And equally, as has been talked with Dr. Masha, the issue of boys also needs to be addressed. I like what she talked about substance abuse. As you know, I'm really passionate about mental health awareness in the country. And what we see is once someone is into substance abuse, what happens? There's a downward spiral. Everyone forgets about them and the various homes that they attend, as Dr. Masha has talked about. So how do we ensure that they are rehabilitated and well aligned? Because what we have learned is that even if you have you have been infected with HIV, even if you have substance abuse or other things, you can actually be rehabilitated and have capacity to support and build the country. So how do we hold their hands and support them? And so I like the theme that we need to support men and boys during this time, but equally have a family approach so that we are not leaving anyone behind, but we are supporting the whole family in health. And that is actually the theme when you talk about universal health coverage. So as we approach this event, I urge everyone, regardless of your age, your background, to join us for the World AIDS Day Half Marathon on the 1st of December 2024. In Nairobi. And this marathon is more than a race. It's a symbol of our commitment to ending AIDS. Let us unite in purpose and show the world that Kenya is determined to leave no one behind in this fight. So thank you, and I look forward to seeing you at the starting line.